Since the summer of 2017, we've been following the life of an Austin girl with osteogenesis imperfecta, also known as brittle bone disease.
Our ELISE ROMAS joins us with the next step in Ellie Butts' journey.
Patients with osteogenesis imperfecta have a higher risk of breaking and fracturing bones. And 2.5-year-old Ellie Butts is no stranger to that. We've seen her as an infant and as a toddler learning to adapt to her diagnosis. But now Ellie's received a surgery that could change the way she lives the rest of her life.
Oh, I got it!
It's playtime at the Butts household.
Here you go. Thank you. You're welcome.
Wow! Filled with fun and laughter. But if you take a look at Ellie's casts, you can only imagine what led up to this moment. About 3 months ago, Ellie was sitting in the pediatric surgery ward at St. Mary's Hospital, a place she's been before, but not for a surgery as major as this one.
She was actually just to the point where her bone, like in her right leg, it just wasn't healing. It had broken so many times it created a weak spot. Thank you.
These are the moments right before surgeons placed rods into Ellie's legs to improve their bone quality and strength. Due to her osteogenesis imperfecta, commonly known as brittle bone disease.
She had been splinted with her leg, I would say anywhere from like 10 to 12 weeks during that time while we're waiting for it to heal.
We knew we had to do something, but we also knew it was a pretty invasive surgery as well.
A surgery expected to take up to 8 hours minimum.
My thoughts were, what's going to happen to her? Like, is that the last day that I was ever going to see her again, or should I end up saying my goodbyes?
But it took a few hours longer due to the nature of Ellie's left femur.
I burst out into tears of joy, and it was probably the happiest moment of my life to know that she made it through this invasive surgery.
And after a rough and at times painful 3 days of recovery in the pediatric intensive care unit, Ellie finally went home to continue her healing process.
We had to make 2 cuts, and it's like trying to juggle 3 balls instead of 2.
Mayo Clinic pediatric surgeon Dr. Anthony Stans has performed many surgeries on Ellie, including her recent rods.
A rod is a load-sharing device, so that much of the work is done by her own bone, which makes her own bone stronger, but some of the work is also done by the rod.
Reducing the patient's risk of fracturing bones for a number of years.
And it's a telescoping rod, so it grows with the patient. And then as Ellie grows from her growth centers, ideally then this rod will move distally and will telescope in the bigger rod.
No.
Now Ellie faces the challenge of learning to do something she's never done before.
And the goal is to get her standing, at least standing, and that's going to take, probably a couple of months.
To do that, the doctors will use what's called a tilt table. Now imagine this is a tilt table. Ellie will lay flat on the table in her braces, and then over time, they'll increase that incline gradually, little by little, to strengthen her muscles until she is standing straight up and down.
Ready?
Oh!
It's been difficult finding someone to work with Ellie on her physical therapy portion of recovery, but the Butts family can still perform some of those physical therapy techniques at home.
And the standard practices for therapy, physical therapy and rehabilitation, they're too invasive for her. I mean, there is a risk of fractures. So any program will have to be modified, for her.
All of this could possibly lead to an even bigger achievement for little Ellie.
I think it's highly likely that she'll be able to walk someday. It may be a while, but I think there's a very good chance that that'll happen.
And I kind of have just put in my mind that Ellie's never going to walk, so that when she actually does, if she does someday, like, just that pure joy. Like, I can't wait for that moment.
It's those tiny rods inside Ellie's legs that will forever change her life.
It's just not the end of Ellie's journey. This is just the beginning.
And give her endless opportunities
I did it.
You did it.
of playtime.
I got it! Yeah! Mommy.
Ellie is still recovering and she's strengthening her legs and has a long way to go still, but her family and her doctors have already started talking about placing rods in her arms as well to straighten them, but Dr. Stans says that won't likely happen for a couple more years.